Complementary medicine, what does it offer? And as Claire's quite rightly pointed out, we're setting ourselves quite a challenge here to talk about so many different therapies in such a short period of time. So, as you probably gather, what I'm going to do is really introduce therapies. You may know of many yourselves, but if you don't, then hopefully by the end of this talk, you know a little bit more about what's called. Now, complementary therapies, complementary medicine, they're interchangeable terms. I'm going to use the term complementary medicine quite a lot through it, but we're really going to be obviously talking about particular therapies. So let's start off by just trying to get a feel of how big the field is, how many different therapies there are, and the nature of them. Okay, so complementary, there is such diversity. A little bit of my own personal history. I used to run a department in a university for about 20 years. I ran a department and we provided the degree courses in complementary therapies. It's a fascinating area to work in. But the interesting thing I thought was that our school, in which we actually provided the complementary therapist courses, was in fact in integrated health, which, as you probably guess, is giving you some idea of my approach towards complementary medicine, that it's something that should be integrated with medical practice, because obviously whatever is going to be most beneficial for the patients is the priority. And obviously, to have complementary therapies alongside working with medicine, it's the strongest combination. I worked in the NHS for 4 years, working in integrated teams, and you could really see the benefit it was for the patients to have that combination. Anyway, enough introduction about my background and why this talk may have a particular slant to it. But let's just get the feel. There are hundreds of complementary therapies, and many of them do complement orthodox medical treatment. And we'll see that, in fact, there was a concerted effort, a very strong effort back in the year 2000 to try and look at the therapies and see what worked and what didn't alongside orthodox medical treatment. But anyway, there are hundreds of different therapies. We can't in this talk look at them all. But if we look at them in terms of their nature, if we want to try and say, well, look, which ones are going to be safer, then obviously what we might look at is their safety record, is their education that's available of a good standard, and is there regulatory organisation? Because you really want an organisation that can really vet to make sure that those practicing are practicing safely. So yes, if we look at two examples, osteopathy and chiropractic, these are two statutory self-regulated, which means that the practitioners themselves contribute to an independent body that actually checks the standards of the practitioners through their ongoing updating and deals with any complaints if there are any complaints. And if there are complaints, obviously have the ability to take people off the register. So statutory self-regulated is the way it's approached for two therapies. But as you probably guess, there are hundreds. There is another organisation called the Complementary and Natural Healthcare Council, and that vets, that checks on standards for 17 other therapies. So there are organisations which do regulate particular therapies, which really, if you're looking at consulting a practitioner from a therapy, you want confidence that it's safe practice that they provide. Just to set the confines today, I'm going to look at the main prescribing therapies in the UK: homeopathy, herbal medicine, and nutritional therapy. You probably would have heard of, obviously, herbal medicine. You may have heard of homeopathy, and nutritional therapy is the largest group of practitioners under the Complementary and Natural Healthcare Council, this umbrella organization which checks the standards for practitioners of those therapies. There are a group of practitioners called naturopaths, and it's a reminder that very often people practice more than one therapy. Naturopaths very often will combine body work, such as an osteopathy or even chiropractic, with nutritional, maybe herbs. So there are combinations. It's quite a complicated field to navigate. Now, if we look at the individual therapies, and I mentioned the year 2000, there was quite a thorough investigation by a Science and Technology Committee. HOL stands for the House of Lords. So it was a parliamentary House of Lords scrutiny of complementary medicine. There hasn't been one since. It was very thorough when it was carried out. And it looked at the whole realm of complementary medicine, and it put them into group, typical science and technology specialists. What they tend to do is want to put things in groups, try to simplify things. So they designed these groups, group one, which is something that's compatible with medicine. There's evidence of its effectiveness. It has good educational standards, and there's regulation. And they put in that group osteopathy and chiropractic, and as you probably gather, that continued to be regulated, acupuncture, herbal medicine, and homeopathy. Now, the reason I put these in different colors is because we're going to look at more detail in these, not just because they are therapies in their own right, but if we look at the whole of medicine throughout the world, very often herbal medicine, and in some cultures particularly, homeopathy is well established. Now, obviously, acupuncture, we're going to talk about that as well. But again, that's part of a medical system. But anyway, group one, back in the year 2000, which is a long time ago now, isn't it? 24 years ago, they published a paper saying that group one, these therapies could work well alongside medicine. And, osteopaths, chiropractors do, so do acupuncturists. Those three certainly are established, and you can get that form of treatment in the NHS. Some doctors are trained in homeopathy, and nearly all the drugs we use are based, 70% of the drugs we use come from herbs anyway. So you probably guess their grouping of these certainly was quite logical. Group one, those which could work safely alongside medicine. Now, group two, these were the ones that were seen to be good for well-being. So although they may not treat specific disease, they would really help with the well-being of the patient. So for massage therapies of a wide variety, there's lots of different massage therapists of different types, but massage basically was seen as something that would benefit how well the patient felt about themselves, which is very important in healthcare, is how good do you feel about yourself, and can you improve your well-being, how you feel about yourself. And obviously massage, aromatherapy, reflexology are examples of that. And these are all under the CNHC, the Complementary and Natural Healthcare Council. They look after a register of practitioners of these therapies. So they're group two. Now, as we're going down the list here, and there must be a group three, and that's the total extent. They put the therapies into one of three groups. And in group three, we have those which are not compatible, not deemed to be compatible with medicine, because they have their own system of diagnosis and treatment. And it was deemed that the evidence base was poor. Now, if we look at this group, there really is, unfortunately, rather illogical assignment to this group. If the one to pick out initially is in group one, acupuncture was deemed to be compatible with medicine because acupuncture can be used for pain relief, anti-inflammatory. So obviously it's a great benefit in medicine. So acupuncture is accepted, but acupuncture is part of traditional medicine, Chinese traditional medicine, which is completely illogical that you can say, well, we'll take out a bit and that's okay, but the whole thing we can't agree with because it's not compatible. But as you probably guess, group three includes some very important medical systems. In fact, medical systems that far outnumber in terms of number of patients treated than treated by the Western medical model of drugs and surgery. So traditional Chinese medicine, as you probably guess, with the billions that exist in China, Ayurveda, which is the Indian medical system, another billion people have Ayurvedic medicine, Unani, again, a very large group of people, and there are other medical systems as well. In fact, most cultures have a traditional medical system. So what we're going to do in this talk is go international now, where instead of just homing down to see what's happened in the UK, what we're going to do is just look at traditional medical system and see from it, we use the abbreviation TMS, just see from it what we can learn. Because in fact, it's a bit like, in the West, we say, oh, well, we've got all the knowledge, we've got all the science, we've got all the medical research, so therefore we know about medical practice. But traditional medical systems, they've been around for thousands of years. And I think there's quite a lot we can learn from them. So it's really what we could learn from them. And let's take a dip into that to see what we're talking about. So traditional medical systems have lots of different aspects to them. They have aspects like exercises, dietary advice, plants, animal, mineral medicines, which is obviously we could group and call these herbal medicines, manual techniques that could apply different types of massage. And in a traditional medical system, spiritual therapies, things like meditation, are naturally integrated within it. So if you look at a traditional medical system compared to a Western medical system, in a Western medical system, you very often get channeled down, directed towards being very, very specific about a particular disease or a particular symptom. Whereas traditional medical systems use lots of different approaches, and what they're aiming for is different. It's to prevent illness and maintain health. So rather than just treating disease, traditional medical systems are ones where you're trying to prevent illness, trying to maintain health, and only if necessary, treating disease. Because obviously, in fact, there are financial incentives because sometimes the practitioner will set up a system where if the person is unwell, they don't actually charge them because they failed in maintaining their health and preventing illness, which is a lovely way round, isn't it? That in fact, you don't pay if you're ill, you only pay, obviously, maintaining health. And if we look at these traditional medical systems, greater than 4,000 years old, before writing was actually developed. So how was the knowledge and the skills turn actually going from generation to generation? It was because it was like an apprenticeship. So you'd had a learned practitioner and an apprentice that would learn the actual art and science. Because obviously, although you would say, well, surely there wasn't science in those times. Yes, the science was there. They would look critically at what worked and obviously learn from those things that worked most effectively. And the interesting thing about the medical model, and You know, in these talks, sometimes we have a little bit of medicine and science before we look at a topic. The interesting thing in traditional medical system, they didn't use this foreign language of science, you know, the anatomy, the physiology, the pathology, the diagnosis. That's another world, isn't it? It's a bit like we have to learn to understand health or disease. But in traditional medical systems, they didn't want to form a barrier with the patient so that the patient could understand what was going on. They'd use very simple models. And the models would be based around things like fire, the properties of fire, the properties of water, and animals, how animals move could be used to describe certain characteristics of the body and help us to understand disease. So traditional medical models, because they've been around such a long time, there are things that really would be good to try and explore to see what we can learn from them. Now, in the West, we've done well. I mean, it's quite sad, really, as I've mentioned when we were looking at that House of Lords classification, that acupuncture is accepted as being compatible in Group 1, whereas traditional Chinese medicine, which is the whole thing, is not, which is, you know, it's a bit like, well, why? If you can accept something, you can't look critically at the rest to sort of see really does what it does offer. Anyway, what we do in the West is we take the bits from traditional medical systems that seem to work. Now, if you think about it, acupuncture, you probably have all heard of, some of you may have even experienced it, and you realize it's very different to Western therapy, but we accept it. It's actually in the health service. There are acupuncture units in some hospitals, which certainly treating chronic pain, chronic inflammation is very effective. And there's good research to show how effective it is. Yoga, as you probably realize, not yoga in classes, but yoga therapy, where you're modeling or designing but specific exercise for the individual, not putting people in rooms of 20 or 30 and everybody doing the same thing, actually having yoga as a therapeutic intervention. And some of you may know about Tai Chi or Qigong. These are all accepted, and it's interesting that they're part, like, for example, acupuncture, part of Chinese medicine, yoga, part of Ayurveda, Tai Chi, part of Chinese medicine. Okay, so let's look at these traditional medical systems. And as I say, it's a bit of an international theme to our looking at complementary medicine this morning. I really want us to step back and say, well, look, what's going on in the world? And in the world, traditional medical systems far outweigh Western. We feel we've got it in terms of medical care, but obviously traditional medical systems look after billions of people throughout the world. And they all have things in common. Very often, what you would do is look at the patient, work with the patient, and look at how their character, how their nature matches the natural elements. So, you know, are they quite fiery? Are they quite earth? Do they have an aspect of their character which means that they're quite airy, quite or running like water? So you probably guess because we understand these elements, we live with them, then we can characterize our individual according to these elements. So in Chinese medicine and Ayurveda, which each of them has over 1 billion people that are actually sustained by that healthcare system, that we would look at these elements of air, fire, water, and metal. The other thing is, we're talking about things that are 4,000 years old. You didn't have MRIs, scanning devices, even ultrasonics. So you had to have non-invasive tests. So you would look at the tongue, you'd look at the eyes, nails, pulse, urine, and stools. All these, because they were outside, they're easily available, and they could, in my childhood, when I used to go to the doctor would look at my tongue It will be one of the initial, and it's one of these things now we've forgotten so many of the skills and the information you can get from simple, non-invasive diagnostic techniques. So literally, there's a whole area of Chinese medicine where the tongue is analyzed as it provides so much information, as the nails can, as the eyes can. These are all non-invasive. And the treatment, remember, is not about, focusing on disease, because things are too late then. What you want is to keep balance in the body by as many different approaches as possible. And let's look at Chinese medicine just to get the feel of what we're saying. So in Chinese medicine, there's lots of physical, energetic things like acupuncture, acupressure, moxibustion. Now, moxibustion, you may not heard of. Moxibustion, it's a bit like a cigar or a cigarette. It's a herb that glows, and you hold it over the acupuncture point, and in that way, help the energy to move. So acupuncture is the application of needles in particular points to help the energy move, because you want balance in the body. And very often in Chinese medicine, when there's imbalance, it's because in the lines of which the energy flows, there's a blockage. So in acupuncture, you'd need a needle to actually unblock that line of energy. Or you could use pressure with your fingers, that's called acupressure, or you can use moxibustion, which are obviously these things like cigarettes or cigars, which are glowing, and it's the infrared on the point which helps to release that blockage. And the other thing you can do is cupping. It's a little vacuum that you put over and it sucks up, and in that way releases the point. In Chinese medicine, there's dietary therapy. So this would be included. In other words, in this country, you might go for an acupuncture treatment in isolation. But in China, obviously, they wouldn't just apply acupuncture or moxibustion. They would give you dietary advice, probably even including herbs. And they might use massage, which is called tuina. And then you've got the energy balances where you're asking the patient to do something, like, for example, Tai Chi or Qigong, which you could say is a type of meditation. So these are all aspects of traditional Chinese medicine. So what I've done here is, this morning we're looking at the whole field of complementary medicine, is just to spend a little bit saying, well, yes, but outside the West, there are these traditional medical systems, and it's not just, India, China, you've got to say North American Indian, it can be Aboriginal, can be Maori, every civilization had a traditional medical system. If we look at the Chinese medicine, you probably realize I've talked about energy lines. These energy lines are called meridians. There are 12 principal meridians, and the criticism of acupuncture has always been, wow, yes, there's nothing medical, nothing scientific you can say shows that these meridians exist. And now we're beginning to realize that our anatomy books have not been very good, because we've forgotten a tissue called fascia, which connects everything around the body, covers everything, and maybe what's happening in meridians is it's bundles of fascia. So these do actually anatomically exist. It's just in our anatomy books in the past, we haven't bothered about fascia because it's just so prolific. It's everywhere. They haven't looked at the structure, the anatomy, to say, oh, this could actually correspond to such and such meridian. So there are these diagrams of the 12 meridians. This is one side. Obviously, the other side of the individual would have the remainder of the pattern. And obviously, there's connections between the meridians and particular body organs. And those body organs obviously can require balancing. The use of needles, finger pressure, moksha, and there's an energy model. Now, this is again a major contrast. If you talk about energy in medicine, then most people shut down because they don't actually have a model or don't have a belief in energy in the body as being something that you can work with. In traditional medical systems, it's a natural assumption that there's energy flowing through the body, and for health, you need natural, balanced flow of energy. So, obviously, in Chinese medicine, the use of needles, finger pressure, or these moksha bastion, these glowing embers at specific points to unblock the meridians. And that's a little picture there to give you some feel of, obviously, these very fine needles that are used. They're very fine, almost you can't feel them when they're put in. And they can, of course, according to the practitioners, actually be used to unblock this energy so that the energy, the chi, the energy can flow naturally. It's interesting. I'm talking about Chinese medicine. I could literally change it and talk about Ayurveda. I wouldn't be talking about chi. I'll be talking about prana. And in terms of energy models and lines of energy flow in the body, again, Ayurveda has its own system. Anyway, so what we've done there is a really ambitious thing, which is saying, right, well, virtually 70–80% of the world's population have traditional medical systems. And we ought to think, really, as I say, how much we could learn from these. As I say, already we've taken things like acupuncture, yoga, and we've used those in medicine. So there are things we have seen to be very effective, but I still think there's more we could learn from traditional medical systems. Okay, so what we're looking at now, having just completed, I mentioned that there were 3 prescribing therapies that are included in the House of Lords Group 1. Homeopathy, of course, was one of them. The next one really didn't fit in. There was just a general recognition that it was important, but it wasn't actually identified as a specific therapy. But over the last 20 years, it has become a therapy in its own right. And for me, it's the weakness of our medical system in this country. I did teach in a medical school for a number of years. I taught medics, and you look at their syllabus and you realize there's areas which are so weak, yet they're so important. And you probably realize that area is nutrition, that there's so little real training in nutrition, yet it's something that it can be so important for so many different conditions. So I'm going to look at nutritional therapy. I've mentioned the CNHC, which is that umbrella organization, and nutritional therapies are the largest group in that professional body. There's over 2,500 nutritional therapists registered in this country, right? And most of them have studied at least a degree level. And of course, many have years of experience of working with patients. Nutrition is a powerful intervention. We were talking about cholesterol, weren't we, in the question and answer session there? And you realize that yes, for some patients, and again, it reminds us how individual we need to treat people. For some patients, then, dietary advice and looking at nutrition can be an effective intervention. But for many others, particularly if there's a genetic characteristic around cholesterol, then obviously dietary advice may not be sufficient. Now, it may not be sufficient to take you well down as a very low cholesterol level, but it may be sufficient to take you nearer to a safety level. If you look at cholesterol levels, the pharmaceutical industry has narrowed what do they consider to be the safe level. So what was, when I taught chemical pathology in a university, that level now is deemed to be unhealthy. And in fact, changing the parameters now for a medicine, it means more and more people are now taking those medicines, and in many cases, they're not beneficial for them to take it. But nutrition is a powerful intervention, and for some with cholesterol levels, as with glucose, diabetes, nutrition can be very powerful and effective, rather than use a medical intervention with a drug. So, use of dietary and health style advice, a supplementation sometimes, that's looking at pure vitamins, minerals, or what we call metabolic intermediates. That means something that's in the body, and if you put more in, helps the body to do that. So very often supplements would be used temporarily until the diet has changed. Changing diets takes time to integrate. So, for example, if we're trying to control cholesterol levels, then obviously it's something that doesn't happen in weeks. It happens very often in months to get a real response. So sometimes supplements may be used to help in that case. So remember, nutrition is only supplying the body with essential substances. What we forget about nutrition is it's equally important how the body gets rid of waste products. Do you remember in the case of traditional medical systems, you would look at stools, you would look at urine, and sometimes it would be just look at, and that was sufficient information, right? But excretion is important. So you can put all the nutrients you want in the body, and if you're not looking after excretion, then your nutrition is not going to be effective. And as I say, this tends to be forgotten in dietetics, whereas in nutritional therapy, it is of obvious concern. So if we look at diet, why isn't diet alone sufficient? Because many nutritionist therapists say, well, really, you do need to use supplements. I'm a naturopath, but I don't tend to use supplements because I feel that they are very expensive very often, and the real solution really comes from diet. But there are challenges to our diet, and as you probably guessed from the media over the last year or so, there's lots of concerns about ultra-processed food, that we are rapidly deteriorating in terms of health because of our consumption of ultra-processed foods. But if we look anyway at the diet, there's a number of reasons why the food we eat is not as good as it used to be. Intensive farming, right, is depleting the soil. So minerals particularly are being depleted. So because we're using the same crop in the same field year after year, remember the traditional way of farming is to have a variety of crops in the fields, or at least rotate them year after year. You would never grow the same crop in the same field year after year. But in intensive farming, what happens is you do that, you deplete the soil, and you probably guess there's a real outcry, certainly amongst some researchers, saying we are destroying the soil that is needed to grow our crops. The other thing is we tend to store things a lot, we transport them, we process them, and certainly with ultra processing, the food deteriorates, its nutritional value is depleted. Cooking methods, for example, using very high temperatures if we use flash high temperatures, that's all right. But if we cook at a high temperature for a long period of time, that can in fact destroy substances that would be a benefit. We might have difficulties with our diet because of stress, because of those things we're trying to cope with in life, our body may not be functioning optimally. So that means that we may not be absorbing our food as well, the nutrients in our food so well. And also excretion inefficiencies. In other words, unless there is a removal of toxin waste products from our body, then the body has to cope with the toxicity of those breakdown products. And we use colorants and flavorants and sweeteners, and all these affect the quality of the diet and obviously the health benefits of the diet. And of course, there's fertilizers, pesticides. So there is concern now that even if we pay attention to diet, it may not be sufficient. And it does mean some nutritional therapies say supplementation may in fact be needed. So if we look at the principles of nutritional therapy, and it's really looking at things like proteins, oils, which are a group which we can put down as fats. And remember, over the last 40 years, there's been this condemnation of fats, saying how dangerous they are, rather than realizing that some fats are essential for the body. Some oils particularly are essential to the body. And in fact, a lot of the thing about fats is misinformation. People have gone back looking at the research that was used to argue that fats were unhealthy, and the conclusions they've come to is that it was inappropriate research. It was out of balance. It had one particular aim in mind. So it means we've learned to hate fats when really they are a very efficient and effective way of consuming calories, right? Whereas carbohydrates are quite dangerous. They're very reactive. So chemically, it's not surprising that the body is happier with fats than it is with a high carbohydrate diet. But anyway, the nutritional therapists would know about this balance, know about the importance, particularly in the elderly, of adequate protein in the diet. It's more important in the elderly protein than it is for younger people. But again, that could be a subject of a talk in its own right. It's the protein level for the elderly. But oils, vitamins, minerals, trace elements, if we don't have an adequate intake, we get suboptimal body functioning and therefore chronic health problems. And what a nutritional therapist will do is to take in account the patient's lifestyle. They would use some biochemical tests. So they would test, are there enough of these particular nutrients, or are there some substances that are there in too high level and therefore might respond to a nutritional therapist intervention. And they may then prescribe a diet. But remember, the diet matches the individual. So the individual is the aim, and very often not treating a disease, but actually treating organ systems. So in other words, if the person needs to get rid of toxicity in their body, they might support the liver function as much as obviously other organ systems. Say it could be the cardiovascular, the respiratory, the lymphatic system. Nutritional therapists don't tend to treat diseases. They will tend to treat the body systems that will help to balance as the disease is obviously expressed. Now that really, I've put in brackets, that is opposite to dietetics, isn't it? With dietetics, you are using dietary advice as really a dietary advice, say for diabetics, or dietary advice for people with high cholesterol, and you realize that so many of those don't work because you're not treating the individual, you're treating a disease or a condition. So as you probably guessed, nutritional therapy is developing now into what's called personalized nutrition. And with personalized nutrition, what you're doing there is looking at what's relevant for the individual. And you can see that there's been a lot of what I call fads, a lot of fashion around diet, that suddenly this particular protocol, these particular supplements are the secret to the answer and you realize that so often they don't work. And why? Is because they're not actually targeted at the individual. It's not personalized nutrition. Now, picking up the question about, well, if you had a high parameter in the blood and it was deemed to be of genetic in origin, then again, obviously, a personalized nutritional approach may be worth re-examining, because sometimes personalized nutrition will make a difference, whereas a dietetic approach, which is, well, you've got that problem, this is what everybody should do, will not be as successful. Okay, so those are the principles. So if we were to put nutritional therapy in the House of Lords categories 1, 2, and 3, hopefully nutritional therapy would now be included in group 1. When it was carried out in the year 2000, nutritional therapists wasn't such a profession as it is now. Right, well, one other one to consider, and with this example that we're going to look at, it's going to link back to the traditional medical systems, you know, the Chinese medicine, the Ayurveda, Unani, all the systems that exist. And this is an aspect which applies and is in each of them. Herbal medicine. Now, herbal medicine has a very long tradition in the UK. It has a very long tradition in Europe. And to be honest, every single country has its own herbal medicine system. And it's part of, and the reason for that is herbal medicine is so much part of the traditional medical systems that I've mentioned. In other words, any traditional medical system would have herbal medicine as part of it. So, and the thing is, the herbal medicine is based on locally grown plants and locally grown herbs. Now, that's in the past. As you probably gather, with international trade, international movement of substances, then it's not surprising that herbs that are used in Chinese medicine now find their way in Western medicine. The same applies for Ayurvedic herbs. Some of those are actually found in Western medicine, herbal medicine. Now, the fascinating thing about herbal medicine is that medical herbalists really make a connection with plants. A good medical herbalist will not only be able to draw a plant to actually draw it accurately with its detail, they would have formed a connection with the plant. Now, you may wonder why I'm saying this. I think it's interesting, very interesting, that how do we know which herbs are beneficial and which are not? And as you probably guess, much of it comes from trial and error. Much of it comes from trying, tasting. And part of herbal medicine is actually what's called organoleptic testing, which is tasting herbs to actually identify characteristics that may indicate it's beneficial. Now, the reason I mention this is that there's been some study of chimpanzees, of apes in the wild, and it's been found that very often a maternal leader, a female in the troop of monkeys, actually has knowledge of plants and will use them over injuries, or if a member of the pack is unwell, or to give them chewed up leaves or leaves to actually use. So, excuse me. So herbal medicine there, it's really part of the knowing comes from the wild, and we will use our local plants and herbs. So some medical herbalists, though, it's fascinating. In herbal medicine, there's different types of practitioner. There's those practitioners that I call reductionist. That is, they treat a disease. So the patient comes with a disease. Instead of using drugs, that particular medical herbalist will advise in terms of drugs that would fit, not drugs, sorry, herbs that are like the drugs, but they will treat the disease. And there are advantages in using herbs rather than pure drugs. The side effects usually of using a herb is less, not necessarily completely none, but much less than using a purified substance. There is a lot of research to show that if you take something, the active ingredient, purify it, give it to the patient, it can be toxic, it can be lethal. But that substance in a herb, because of the other 100 or 200 substances in that herb, can be safe. right? It's fascinating, the characteristics of herbs. And it's this thing that the pharmaceutical industry thinks that purity is the answer, when very often it's the problem. Because if you purify something too much, it can become too toxic. And that's why herbal medicine is part still of, the majority of people in the world still get their active chemical substances from herbs rather than pharmaceutical products. So knowledge of herbal medicine was and is passed down by word of mouth. Remember, in traditional medical system, 4,000 years, we can say that that knowledge has been coming down in Chinese medicine and Ayurvedic, and even in the West, our medical systems, herbal medical systems, over millennia. And that knowledge is still accumulating. The pharmacopoeias is the way it's now recorded. It didn't used to be pharmacopoeias because, of course, what people couldn't write in those days, they didn't have a recording device. So it was literally by word of mouth. And if we look at it, 80% of the world population uses herbs as in primary care. 80%, 70% of current drugs have their origins in plants. And obviously the most obvious one is aspirin, isn't it? It comes from the bark of a tree, and it's been used to if you extract it from the bark of the tree, that would have been the medicine hundreds of years ago. Now we obviously have this pristine tablets, white tablets, which contain the same active ingredient. And again, the question is aspirin in a herb safer than obviously a pharmaceutical product? And of course, now synthetic copies are formed. Right, so let's just look at the principles of herbal medicine. And again, just tying in with the fact that, yes, plants have numerous active ingredients. They have less side effects normally than the isolated pure ingredient. And remember, the thing about a herb is there might be one particular agent in it, chemical in it, that is producing the desired response, medical response, but the other 150 ingredients may help that response or help with the side effects that might come from that particular active ingredient. So, as I say, there's been some fascinating research showing if you purify something, you can land up not being able to use it because it's too toxic. Whereas if you use the herb, it's fine. And it's fascinating. And there's been some very sad examples where herbs are banned in some countries, not because the herb is toxic, but because the pure ingredient is, without realizing that, of course, the herb is the way that you would want to use the active ingredient. Anyway, principles of herbal medicine then, they're used to support organs and systems. And again, they're widely used for a wide variety of different symptoms, emotions, even social and spiritual aspects of the individual. So remember that very often a medical herbalist will take a very broad, holistic approach to case history taking, trying to capture, organ systems, parts of the body that are out of balance, and that can be from a wide variety of different aspects, but again, focused around the individuals and not suppressing symptoms. And this is a very important aspect, again, of herbal medicine. Remember, in homeopathy, it applies as well, that what you're doing is encouraging the body to take over the healing that's needed. Whereas, of course, remember, a lot of our drugs suppress symptoms. Say, for example, you've got inflammation, you take an anti-inflammatory, rather than saying, well, why is that part of the body inflamed? What's out of balance there that needs treating? So remember, antibiotics to kill bacteria. Do we need to kill all the bacteria, or is there a way of rebalancing the bacteria? So a lot of our medication is what we call anti, is to suppress, whereas in herbal medicine, you very often will want to support. I worked for a number of years in Africa and worked with traditional medical healers, and it was fascinating because if the patient has got something wrong with their digestive tract, what the traditional medical healer would do would be to facilitate or to support or to help them vomit or to cause diarrhea. Can you imagine in the West doing that? Can you imagine they're going to a doctor and they're saying, well, take this treatment because it will make you vomit more or it will make your diarrhea more effective? But if you think about it, when the body vomits or has diarrhea, it's to get rid of something that's in there that shouldn't be there. So we shouldn't suppress the symptoms, as can sometimes happen, because we consider it as inconvenient that we have these symptoms, but you actually encourage it. And by encouraging it, you help the body to get rid of it. Can you see it's a whole mind frame change? Herbal medicine is an example of it. So herbal medicine application then, yes, internally you can make teas. That's what an infusion is. You can boil up herbs in water. That's what a decoction is. For some, you could use an alcohol extract, but if you don't want to consume alcohol, there are other preparations, obviously, and these can be dry herbs or pills. Those are internal, or you can use them externally, compresses, poultices, suppositories, baths. So herbs can be used in a number of different ways. Okay, so, right, what we've done this morning then is just touch the area of complementary medicine, as you probably guessed, with 150 different, at least 150 different therapies. It would take the best part of a lifetime to go through them all. Hopefully what we've done this morning, though, is touch on some of the different therapies, but also give you a feel of the different mind frame that we could use in maintaining health. And notice what I've said, not obviously treating disease, but maintaining health, which is really what a health system should be designed to do, shouldn't it? Anyway, let's look at complementary medicine then, because one thing is we do need research, and the trouble is there's not the research is not being funded, because most pharmaceutical companies they will want to obviously test their latest product. They're not interested in really testing herbs and or nutritional therapy supplements for their action. But the one thing that a medical herbalist now, medical herbalists and nutritional therapists need to know what drugs a patient may be taking, or the foods they're consuming, or the herbs or supplements. So there is here the need to remember that if you are using a prescribing therapy like herbs and medicine and nutritional therapy, that you would need to know what drugs a patient is on or any other medication, just so that you know what possible interactions they can be. And current courses for nutritional therapists and medical herbalists include that as part of it. They will look at, could there be adverse interactions? So further research is needed on the effectiveness and safety. The one thing that we can actually say, though, is that many complementary medicines have been used or tested for their effectiveness and their safety for centuries, and in fact, in most cases, millennia. If you're looking at herbs in Europe, many of them have been tested for thousands of years. We know about their toxicity, we know about their limits, right? But this research, unfortunately, doesn't fit the category of being randomized controlled trial. And it's quite sad, really, that obviously we're left in a position where the complementary medicines are criticized because there's not enough research, yet obviously very often the research model used is inappropriate because it's based not on the individual as complementary medicine is, but looking at a disease. Now, as I've mentioned, what I'd like to go on to is look at, and again, a little bit of a challenge, because today I want us to just be a little bit challenged about looking at particular therapies, because I think there's so much to learn. As you probably gather, having run a department where I had 7 different therapies being taught, you realize that there is so much diversity in complementary therapies or complementary medicine. And they're all things that we could use and could be of benefit to us. As you probably realize, for about 30 years of my life, I was involved in trying to promote integrated medicine. And as I say, I did work in a GP practice where this was, integrated, in such a level that, the patients would be discussed at a level of, well, what therapy would work for them. It didn't matter if it was medicine or social care. It could be a complementary medicine if it was deemed to be probably the most effective for the patient. Well, let's look at one which is very challenging. Come on, let's be brave. And the one which is challenging is homeopathy. Do you remember when I was looking at the House of Lords paper, House of Lords research paper with the science and technology, they placed homeopathy in group 1. Now, that made a lot of people very unhappy. Why? Because homeopathy defies the law of pharmacy, right? There is a complete contradiction that homeopathy does the opposite of pharmaceutical intervention. Now, I'll come back to that as we go through, but I think there's a lot to learn from homeopathy, and it's quite sad because in the UK, there's been really stringent, really vicious attacks on homeopathy and homeopaths and doctors and vets that use homeopathy. There is a group of doctors, there is a professional body for doctors that practice homeopathy, and there are vets that practice homeopathy. So it's fascinating that despite the attacks, that there are these groups still in existence, but there are groups of the pharmaceutical industry that really are threatened by homeopathy and have done everything they could to remove it from provision in the UK. Anyway, let's talk a little bit more about it, and you'll see why it is very challenging for medicine. So homeopathy is considered to be complete and is safe and gentle and holistic, because if we look at what the remedies are made of, it's got to be safe and gentle because the way that it works, and because of the nature of a homeopath, they try and encompass everything about their patient. So a patient may come with a headache as an example of a symptom, but the homeopath will look at the whole person and treat the whole person. And the interesting thing about homeopathy, it's been around for a couple hundred years. Substances are poisonous in large doses are considered to be beneficial in small doses, and we're talking about very small doses. So initially, some of the substances used in homeopathy, if you use them in large doses, they'd be toxic. But because you use them in such small doses, they are beneficial. The example I use here is if you think of arsenic, you probably realize arsenic is very poisonous. But if someone is ill, and the tradition in the West very often is if they are ill, they will eat fish that are bottom dwellers that live at the bottom of the sea. And if you analyze them, they have higher levels of arsenic, not poisonous levels, but very low doses. So when people are in this country, you feed them very often flat fish, that because they contain arsenic, that arsenic is beneficial. So arsenic is one of those substances in small quantities is beneficial, large quantities is certainly poisonous. Right, so it's about, in homeopathy, tending to get the body to heal itself. So you consider all symptoms, not just their presenting symptom, but all symptoms, anything which is out of balance. So it fits in with traditional medical systems, doesn't it? And it's not surprising that homeopathy is now the greatest centre, the strongest centre for the practice of homeopathy is India. Because as you probably guess, looking at the way we're talking about homeopathy, it fits in with Ayurvedic medicine quite comfortably. So the patient or the individual is what is treated, not the disease. And you know, a number of practitioners and even medical practitioners in this country do express concern about the focus around treating a disease rather than looking at the whole patient or the individual. In other words, you know, the patient is not the disease, it's the patient that needs to be treated. And for me, that it's fascinating, you know, watching homeopaths work when you realize how thorough their case history taking in. And you can see that they're getting down to talking about the individual rather than the disease that they may have presented with. And we have different types of homeopathy. We have what's called classical homeopathy, where a single remedy may be used. And then there's multiple remedy use, and that's called complex homeopathy. And in for example, Germanic countries, particularly Germany, Austria, very often it's complex homeopathy, whereas in the UK, there are a lot of practitioners that would just use one remedy at a time. And that one remedy encompassing all of the features that need to be supported and balanced in the patient. So if we look at the nature is a lot of information. As I say, watching a homeopath take a case history is a learning experience. When I realized as an osteopath, I thought I was actually being holistic. And you look at a homeopath practicing and you realize how much better they were at taking a holistic case history. So you look at the individual symptoms, and that's physical, mental, emotional, and that's called the totality of the symptoms, right? Individual symptoms, that's the totality. So, and the remedy or remedies can be plural. Remember, if we're looking at complex homeopathy, that treats the totality of the individual, because you're treating the whole person, not just the symptom they're presenting with. And the interesting thing is, and this is where we're in conflict with it between homeopathy and medicine. In homeopathy, you will use something that produces the symptoms in a healthy person that you are treating in the person that's unhealthy. So it's you're using like with like, but remember the thing is you're using very diluted quantities. So dilute, as we'll see, that there's virtually no substance present, and in most cases there isn't. So back in 1790, a doctor called Samuel Hahnemann proposed homeopathy treatment, and he only used homeopathy. He developed it based on the laws of similars, which is, as I say, symptoms in a healthy person. If you meet them in a person that's unwell, then you use that remedy. Like will cure like. And believe it or not, I used to work in the Medical Research Council, and some of my fellow researchers were actually using things that would actually cure or be characteristic of a healthy person, and studying those to see in a person that's unwell whether those would work. And there's some very interesting research to be seen. The treatment works on the person's energy, so it's an energy treatment. Do you remember what I said about medicine and science? In medicine and science, there is a lot of resistance to talking about energy in the body. In the traditional medical systems, Chinese medicine, Ayurvedic medicine, Unani, if we're talking about North American Indians, if you're talking about Aboriginal, energy would naturally be considered, as would spiritual connection. And you probably realize it's a part which is ignored in the medical model. there are some practitioners that are beginning, some doctors that are beginning to look at the area, but you realize if you're treating the whole person, don't you need to look at their energy, what's going on for them energetically in their body? So if we look at the remedies, and again, this is where, do you remember I mentioned that the pharmaceutical industry is not happy about homeopathy, particularly homeopathy being promoted as a meaningful treatment. So they've done a lot as they can to discredit homeopathy, and we'll see why. And the criticisms, yes, you could say, yes, it's unscientific, but it's just that it doesn't fit some of the other sciences, and not all sciences agree with one another. So anyway, let's look at, and one of the problems is this thing about dilution. In homeopathy, as I've mentioned, arsenic is a poisonous substance, but if you take minute quantities of it, it seems to stimulate the body. And the same thing with homeopathy. Some of the things are quite poisonous or very poisonous, but because we're diluting them, and the dilution is 1 in 100 very often, if you've ever come across homeopathic remedies, they're very often given a letter C or D, or some other letters, but they're very big numbers. But basically, a C is 100th. So put in 1 drop of this substance, which could be quite poisonous, and you're diluting it in 100 drops of water. Now, that's a 100 dilution. Now, most remedies in homeopathy are things like 30C or even 200C. So that means you do 1 in 100 dilution, take out a drop and put it into 100 drops of pure water, shake it, and then take it again. And you do that for 200C 200 times. Can you imagine how diluted that substance is? It's so diluted that mathematically, scientifically, there can't be anything of the original substance present. Now, can you see how that in science and medicine will cause a lot of people to be very questioning in how can, if it's not there, it actually produce an effect? So dilutions until no trace of the substance. And unlike pharmaceutical industry, where if you want something to be more effective, you would increase the dose, in homeopathy, you increase the dilution, right? So can you see, not surprising that the pharmaceutical industry is very uncomfortable about homeopathy because it contradicts all their models of dose response. So there's lots of different ways of taking these remedies, tablets, granules, liquid. They're gentle and safe for all groups. The fascinating thing is the work that's been carried out with babies and with animals, because with babies and animals, they have no idea what's going on, yet they get the beneficial effect of the remedies. So it does make you realize that and remember how safe they are because of the level of dilution. So these have been tested, and they're not tested on animals, they're tested on humans first. It's called approving. So it's very careful in terms of the morality about testing these remedies. All new remedies are tested on humans first. So they're not addictive, they're not damaging, no damaging side effects. They're safe to use alongside conventional medicines. And remember, there are at least a couple of hundred, I think it's about 300 doctors that practice homeopathy and register with the Faculty of Homeopaths to actually, to register as a group. Okay, so that's homeopathy. Should we just then go on to looking at what we can treat? So if we're looking at treating, and here I'm going to look at some of the controversy around homeopathy. There's an organization called the Advertising Standards Agency, and they don't allow therapists to treat diseases, named diseases. So in other words, a homeopath, even though a patient might come, say, with, say, for example, asthma, won't allow the homeopath to say, yes, I can treat your asthma. So they can only do it if they can prove what's called a randomized controlled trial. These are very expensive to set up. To set them up, it costs tens of thousands of pounds. You have to have everybody with the same symptom and treated the same way to see whether that treatment is effective. Now, we have a problem here because homeopathy doesn't treat a symptom, it treats an individual. So, in other words, one of the requirements of a randomized controlled trial is that everybody has this defined disease or condition. But homeopathy doesn't treat particular diseases or particular patterns of symptoms. It treats the individual, and therefore you would use a different homeopathic remedy probably for every patient. So can you see, there you've got advertising standardization say, well, you can't say you treat a disease unless you've done this randomized controlled trial. But to do a randomized controlled trial, you're defeating the whole thing about homeopathy, which is treating the individual. And can you see also with Chinese medicine, Ayurveda, no wonder they put it in group 3, because of course you can't carry out a randomized controlled trial when you're treating individuals. You've got to treat them all the same, but that's not the way these traditional medical systems work. So it's used to treat people with acute fevers and chronic problems, long-term problems, but remembering the ASA agent, the agency, Advertising Standards Agency, won't let homeopaths say that they can treat named conditions. So they won't say they can't treat arthritis, eczema, asthma, headaches, menstrual disorders, digestive problems, insomnia, ADHD, attention deficiency, hyperactivity disorder, hyperactivity. All of these, homeopathy has been proven in a clinical environment to be effective again with these conditions, but obviously homeopaths are not able to practice this.